So there's certain areas that surgery approaches very well, and there's certain areas that surgery doesn't approach so well. And really what I call those are the maintenance areas. And really and those are going to be skin and around the mouth. And these are areas that no matter the surgeons have been trying to come up with a solution that looks right, but you can see any number of failed attempts in the Hollywood register where celebrities have had very competent, very excellent surgeons overdoing things around the mouth. So what I found was with the technology advancing that certain areas are now better treated by non-surgical. The advantage that we have is that we offer the entire spectrum of care. We can do the non-surgical, which we enjoy and we're very expert at. But we also, when you've crossed over and the non-surgical no longer applies or you need surgical treatments, we offer those too. And we know what works best with each situation. So the best example is, when do I need a facelift? And the answer is, in my view, when you've lost a lot of the shape to your neck. There's redundant skin. There's no technology, non-surgical technology that addresses it as well as a facelift. They have tried some new technologies in those areas and they're okay, but I don't think they're quite as exciting as what we do surgically. People are looking for subtlety, and I think a lot of the non-surgical treatments are much more subtle. This is in contrast to what happens when you talk about body procedures. There, people want a result. And I'm not necessarily saying overdone results, but a very dramatic result. And that's what people are satisfied with. The subtleties that make people very happy in facial procedures don't make people nearly as happy in body procedures. And that's the contrast that you have to work with. And so the body procedures are done with aggressive surgical techniques, and the facial procedures are done with a delicate touch. And the reason I'm expanding the non-surgical practice is that the technology has developed so significantly over the past few years that a lot of the things that we could only do surgically are being very well served with non-surgical technology. Why are non-surgical procedures becoming more popular is that we're living in a more and more visual world. And I think that's brought to us by the internet. I think we're looking personally in our personal sphere at selfies, and I think professionally our images are everywhere. We're being constantly videotaped. We're constantly expected to provide our images of ourselves out in the world. And so people have now taken time to look at themselves because the pictures and images that are constantly around them of us and our friends, and you realize, oh, I don't look so good in that light. How can I fix that without a lot of downtime? And I think that's driven a lot of demand for these non-surgical techniques, that just with a little softening there and a little filling there makes you just look a little bit better and rested with very little downtime. And I think that's driving a lot of what we're doing non-surgically.